It can affect women and men as we age. We're talking hormones. I went to the spa at West Glen to learn about restoring hormone balance for today's Hello Beautiful. Dr. Heidi, you are offering hormone replacement therapy.
We are. So it is bioidentical hormone replacement therapy, and the importance of that bioidentical is huge. So what that means is it is the exact same structure of the hormones that you make that we are going to replace. And because of that, we're going to be able to treat symptoms that everybody experiences going through menopause, perimenopause, and even for men, it's called andropause. So we can treat all of those symptoms.
I see your book back there, Hormone Optimization in
Yes.
Perimenopause. So this affects a lot of women and men in that even 30, 40, 50 age range?
Yeah, so when we're talking about hormone replacement, it really encompasses a lot of different hormones. For sure, the hormones that we think of are estrogen, progesterone, testosterone, but it goes even further into thyroid hormones and cortisol, which is your stress hormone. Also, vitamin D is a hormone, and they all play together, and they either can play very nice together or they can really fight with each other. So in order to have a patient really feel good, we need to pay attention to all of them. And so when we optimize them, we're looking at a whole array of different things in trying to make the patient feel the very best.
And how does this work? How do you know what hormones are maybe askew?
Yeah, so starting 10 years prior to going through menopause can be when testosterone starts to fall. So for women, that is fatigue, kind of just losing motivation, along with a drop in libido even. So then your progesterone drops, and that's when your sleep gets a little funky and you can't fall asleep and you're up all night or wake up in the night, and then your estrogen drops, and that's when the hot flashes, the irritable, you feel sweaty, all of that kind of stuff. So it can start 10 years prior to menopause. So what we can do, and even early on, we can do blood work and we can kind of see where you are. So we pay attention to symptoms. We have a whole symptom checklist. We look at blood work, and then we decide what is the best treatment. And then we can replace hormones in a variety of ways. We can use pellets, we can use creams, we can use capsules in some of those forms of hormones.
And so is this good for anyone that's experiencing those symptoms?
That's what I would start with, is the checklist, because that will give you a good idea of where you fall. Depending on if you have one, you're probably doing pretty good, but if you have multiples, it's the starting discussion point of if your hormones need regulated.
And how would we get started doing this?
So it would be a quick consult to see where you are with symptoms, and then we would start with labs. Once we are done with the labs, we would sit down for a pretty lengthy consult to see where we want to go and how we want to get you there. So labs would be the first thing.
And you're passionate about wellness overall, as evidenced by everything you offer here.
It is, and I think, with the success of the weight loss clinic, these two pair very well together, and I think that they will be synergistic in helping patients live lives that they just feel more energy and more motivation to go out and do everything.
You can set up an appointment online at spawestglen.com or call 515-207-6788. Dr. Heidi and her team are located off Mill Civic Parkway in West Des Moines. Follow her on social media for more skincare tips and wellness advice, and learn about the latest product trends.